surfaces on the back. They are not two, they are mainly three. Lateral surface, the biggest one, and this is the medial surface, and this is the most medial surface. As we said, in the usual position of standing, while the knee is extended, the lateral surface and the medial surface are attached to the femur. But when you flex your knee, the most medial surface will come in contact to the medial condyle, medial femoral condyle, instead of the medial surface. How can I know the patella is right or left? Very easy to identify if the patella is right or left. Just hold it in your hand and then make the apex pointing downward and the base pointing upward, and then put it inside in a table. The side where the patella lie, it is equivalent. If the patella lie on this side, this means it's a right patella. If it's lie on this side, this means it's a left patella. So make sure that the apex is pointing away from you. While when you put the patella on table, make sure that the apex is pointing away from you. Then put it on the table. If it's right on your right hand direction, it's a right patella. If it lie on your left hand direction, it's a left patella. And I have got another video demonstrating this on a real patella in my channel. If you search for it, you will find it. طبعا to identify the femur, if it's right or left, is easy and is not difficult. You just make the head pointing medially, and the linea aspera should be posteriorly all the time, and you will know this is the right femur because the head is going medial, linea aspera on the back. This cannot be the left femur. Okay, this is the patella in place. The patella, as you said, this is the lateral surface of the patella attached to the lateral condyle of the femur. This is the medial surface of the patella attached to the medial femoral condyle. And of course, the patella is stabilized by ligaments. Here, patellar tendon, we call it. This is the patellar tendon, which is attached here, joining the patella to the tibial tuberosity. It joins the patella to the tibial tuberosity. And this is the quadriceps muscle, as we'll come to it later on, which are attached to the patella. Patella actually is a sesamoid bone because it arises from ossification of the tendon of this muscle, the quadriceps muscle. Now we come here, we can see the bones of the leg, the tibia and the fibula. طبعا the broader one is the tibia and the narrower one here is the fibula. Tibia is always medial, while fibula is always lateral. You have to fix this rule. طيب, the tibia has got upper surface almost flat. This is called tibial plateau, and in this surface we can see two eminences here. بنسميها tibial eminences, and we have inter eminences notch. This is tibial plateau, join or receive the condyles of the femur. The femur weight, which is carrying all of your weight, comes to this tibial plateau. عشان كده tibial plateau fractures are not uncommon, and usually they occur with falling from height. If you fall from height, from a high distance, on your feet while you are standing, you can fracture the tibial plateau here. On the anterior aspect of the tibia, here we have the tuberosity called tibial tuberosity, which receives the patellar tendon, and the insertion of the quadriceps muscle. Then comes the shaft of the tibia going down to the medial malleolus. This is the medial malleolus at the lower end of the tibia. التيبيا طبعا عندها بوردر بيجي من هنا اللي هو ده الانتيرير بوردر بتاعها. lateral to this border here is called the anterior surface. This is the anterior surface. And also, if you come close, you can see this is the anterior border of the tibia, and here is the lateral to it. This is the anterior surface. And also here we can see this is the medial surface of the tibia, and on the back we have the posterior surface. So the tibia is more or less a triangular bone. It's a triangular bone. It has got a medial surface, an anterior surface, and on the back a posterior surface. The posterior surface on the back, this is the posterior surface, you can see, is for muscle attachment. And it is divided by this ridge or this line. We can see here, this is called soleal line. The soleal line separates the posterior surface into upper part and lower part. We have muscles in the upper part and we have muscles in the lower part. And in this line, soleal line, we have also a muscle attached, which is called soleus muscle. Soleus muscle. طيب, لو عينا هنا, if we look to the زي ما قلنا عندنا the medial surface of the tibia, this one, the medial surface of the tibia here is a subcutaneous surface. It's totally a subcutaneous surface. فعشان كده this makes the tibia prone to fracture easily. It can be fractured and trauma. You can fracture the tibia. زي الباتيلا برضه subcutaneous ممكن to be fractured easily. والمشكلة ما بس في الفراكشر. The problem is not just the fracture. The problem is infection of the bone, because the bone is directly attached to the skin. It can be easily damaged or fractured, and الحاجة الثانية can be easily infected. Infection of the bone, we call it osteomyelitis, and this is very serious. عشان كده tibia is one of the common sites which can get infected. اللور end of the tibia دي هي عظمة الشيطان اللي بيسموها، اللي هي الميديال ماليولوس زي ما قلنا. هنا ده head of the fibula. The head of the fibula articulate with the tibia in what we call it proximal tibiofibular joint. And this is the neck of the fibula. There is an important nerve course around the neck of the fibula, اللي هو common peroneal nerve. We'll talk about it later on. And fracture of the neck of the fibula is serious because it can injure this nerve, the common peroneal nerve. This is the shaft of the fibula going down until we reach the lateral malleolus, اللي هي عظمة الشيطان الموجودة lateral هنا, lateral malleolus. Of course, the fibula will join the tibia in the lower part also in what we call it the inferior tibiofibular joint. It's a fibrous joint, very strong joint. The proximal joint may communicate with the knee joint, but the distal joint, the whole inferior tibiofibular joint, doesn't communicate with the ankle joint usually. We can see a membrane here joining the tibia to the fibula, what we call it the interosseous membrane. This is the interosseous membrane. So this is in short a description of the tibia and the fibula. طبعا هنا if we go to the back here, we can see the the femur. The femur ossify from centers in the upper part and the lower part, but when usually the lower center is the growing center of the femur. So this close, the upper center may close earlier, like in the lower center is the growing center, okay? And usually it completely ossify at the age of 20 years. The hip usually completely ossify at the age of the hip joint usually completely ossify at the age of 18 years. If you go down here to the patella has got multiple centers to ossify. Sometimes the patella may not completely fuse. It may show a line here separating the patella into two parts in X-ray. You may think this is a fracture, but actually this is just failure of fusion. And this is called bipartite patella. نسميها bipartite patella. A tibia, usually the lower end of the tibia will close completely before the upper end. If the growing end of the tibia is the upper part. This is the growing end of the tibia, and also it completely ossify at the age of 20 years. طيب, this is the knee joint. The knee joint is compound joint. It's an articulation of the patella to the femoral condyles. At the same time, articulation of the femur to the to the patella. Articulation of the femur to the patella. والknee joint هنا فيه ligaments طبعا. هنا فيه lateral collateral ligament. وهنا في الميديال collateral ligaments. They fix the knee joint. الميديال collateral ligament جاي من الفيمر هنا, من الميديال femoral condyle going down to the tibia. والlateral collateral ligament is coming higher from the lateral femoral condyle down to the fibula. These ligaments, they are important to fix the knee joint, and they can be injured, they can be torn. Ligament injury. في important ligaments inside the intracapsular. These ligaments are extracapsular, لكن دي intracapsular ligaments اللي هي extra synovial, outside synovial membrane, but inside the capsule. This is, as you can see, this ligament here is coming from the tibia, the upper surface of the tibia, going back to the lateral part of the femur obliquely. This ligament is called the anterior cruciate ligament, الرباط الصليبي الأمامي. And behind it is another ligament going in the opposite direction, so they are crossing. And the ligament behind it is the posterior cruciate ligament اللي هي الرباط الصليبي الخلفي. تمام؟ طيب دي الباتيلا طبعا زي ما قلنا تبقى هو عباره عن كومباوند جوين بين باتيلا فيمورال اند تيبيو فيمورال. في ليجامنتس ثانيه طبعا بورا، في حاجه اسمها الاوبليك بوبليتيل ليجامنت والاركيويت بوبليتيل ليجامنت they are on the back يعني. في cartilage هنا you can see cartilage separating the femur from the tibia. There is they are not in direct contact. There is a separating cartilage here اللي هو واحد جاي ميديال اسمه الميديال منسكس very يعني which is not very vascular or avascular، وواحد ثاني هنا اللي هو lateral meniscus. So we have the medial meniscus and the lateral meniscus. They are the separating cartilages within the cavity of the knee joint. Okay. كل الليجامنتس والحاجات دي they can be injured, and when we come later on to the clinical revisions we will know that they are at risk of damage or at risk of trauma injury. Now all of your weight comes through the tibia to a bone here which is called the talus. These are the tarsal bones. This is the talus. It receives mainly the tibia in what we call tibiotibial joint or the ankle joint, and also the fibula. The fibula also articulates with that talus. And this joint is fixed by a ligament medially between the tibia and talus, tibiotibial ligament, and we call it deltoid ligament, and a ligament laterally here between the tibia and the talus again, tibiotalar, and between the fibula and the calcaneum, and the tibia and the calcaneum. If it's calcaneotibular and calcaneofibular ligaments, we call them the lateral ligament. So let us reorganize this. And the medial ligament اللي هي tibiotalus between the tibia والtalus, this is the medial ligament or the deltoid ligament. Laterally هنا between الفيبولا والكالكانيوم وبتوين التيبيا والكالكانيوم، يبقى مسميها شنو؟ يبقى حتكون multiple ligament صح؟ laterally calcaneofibular and calcaneotibial. الكالكانيوفيبولا ذاتها فيها anterior وفيها posterior. يبقى the tibia and the fibula مع التالس بيعملوا لي الانكل joint، وبرضه ممكن ادخل معاهم الكالكانيوم. التالس sit over the calcaneum. This is the calcaneum. The talus articulate with the navicular بالhead. This is the head of the talus. طبعا التالس عنده head وعنده neck. Fracture to the neck of the talus ممكن يعمل لي avascular necrosis to the head. نفس الحكايه اللي قلناها في شنو؟ The same thing that we have mentioned in the femur. يبقى التالس articulate مع النافيكولا. الكالكانيوم articulate مع الكيوبويد. الكيوبويد is a wedge shaped bone يعني broader laterally and narrower medially. النافيكولا articulate مع الكيونيفورمز، الميديال كيونيفورم، الانترميديت كيونيفورم واللاترال كيونيفورم. So again التيبيا والفيبولا they go to the talus. التالس sit over the calcaneum. يبقى all of your weight ultimately go to the calcaneum. عشان كده falling from height also can fracture the calcaneum. The talus articulate مع النافيكولا، نقوم نسميها talonavicular joint fixed by ligaments. والكالكانيوم articulate مع الكيوبويد، نقوم نسميه calcaneocuboid joint. وديل كلهم الجوينت التالونافيكولا جوينت والكالكانيوكوبويد جوينت الاثنين مع بعض كده بيسموهم الميد تارسال جوينتس. الميد تارسال جوينتس. وفي جوينتس تحت التالس اللي هي السبتيلر جوينتس، مش كده؟ طيب النافيكولا ارتكليت مع الميديال كيونيفورم والانترميديت كيونيفورم واللاترال كيونيفورم. اوكي؟ بعد ذاك بيجيني طبعا هنا الميتاتارسلز. عندنا الفيرست ميتاتارسل، السكند ميتاتارسل، الثيرد ميتاتارسل، الفورث ميتاتارسل والفيفث ميتاتارسل، وكلهم اتاش للفالنجز. عندنا البروكسيمال فالنجز والديستال فالنجز. هنا البيكتو طبعا بس فيه اثنين، بروكسيمال فالنجز وديستال فالنجز، لكن الباقيين في بروكسيمال وميدل وديستال، بروكسيمال وميدل وديستال، بروكسيمال وميدل وديستال اند سو اون في الباقيين كلهم. الجنكشن بين الميتاتارسلز والفالنجز دي كل ديل بنسميهم ميتاتارسوفالنجيال جوينتس. ديل ميتاتارسوفالنجيال جوينتس. اما الجنكشن بين الفالنجز في مع بعضها بنسميه الانترفالنجيال جوينتس، بنسميه الانترفالنجيال جوينتس. اوكي؟ فدي الحاجات المهمه في الفوت. طبعا زي ما انتم شايفين الفوت بتكون في شكل ارش. عندنا يعني الفوت ما بتكون فلات. عندنا حاجه اسمها الميديال ارش اوف ذا فوت، وهناك اللاترال ارش اوف ذا فوت. الميديال ارش البيلرز حقته يعني حاجه الماسكه في الارض الاتاش للفلور، الكالكانيوم البيس تاع الكالكانيوم هنا اتاش للفلور، والهيد اوف ذا ميتاتارسل دي الحاجه الاتاش للفلور. الباقي دي كلها مهويه يعني باقي الشافت اوف ذا ميتاتارسل والتيلس والنافيكولا والكالكانيوم، باقي الحاجات دي كلها they are here, they are not on the floor. عشان كده it make an arch. اوكي؟ نفس الشيء عندنا هناك lateral arch وفي transverse arch. There is a transverse arch through the area of the cuboid and the navicula we have transverse arch. Later on هنعرف المسلز والligaments which maintain the integrity of these arches. في muscles وفي ligaments they maintain the integrity of these foot arches. Okay? clear؟ يبقى دي بالنسبة للquick revision للحاجات المهمة أو الquick introduction يعني عن البونز بتاعت lower limbs. I hope انكم you go and revise the bones of the lower limbs and we will meet again inshallah. Good luck for everyone.